Hundreds of people line up to get medication or an appointment with a psychiatrist at Delhi's largest psychiatric hospital. The Institute of Human Behavior and Allied Sciences is a temporary home for patients with the most severe cases of mental illness. Dr. Deepak Moyal, a resident here, took us through the locked wards. This is one of the best mental hospitals in the country, but even here, they have few resources to help.
I used to see this ward previously.
There are roughly 70 million people with severe forms of mental illness in India, but fewer than 4,000 psychiatrists in the entire country to serve them.
These patients have been suffering from long-term mental illness. They require some sort of supervision in their life. We don't have a support system for them right now.
Dr. Moyal says some of these patients could leave the hospital if care was available in their communities. But in most communities, that simply doesn't exist. To help fill the gap, the Institute launched an evening pop-up clinic, taking the care right to the streets. People come here to get medication and have one-on-one appointments with doctors or psychiatrists.
Majority of them are without any family members. They come on their own, we prescribe them drugs, call them after a short follow-up, and they report back to us.
Dr. Moyal and his colleagues hope that by providing care in the community, they will reach people in need before they require institutional care.
I want you to imagine this for a moment.
Dr. Vikram Patel is a global expert on mental health and one of the pioneers of community-based care.
The idea that you can actually address population mental health needs by more specialists, I think, is unlikely to be affordable or even potentially acceptable to people in the community.
He says the answer in a poor country like India is in training people in the community.
Ordinary people had been trained to deliver babies, diagnose and treat early pneumonia to great effect. And it struck me that if you could train ordinary people to deliver such complex healthcare interventions, then perhaps they could also do the same with mental health care.
In the slums of Pune, a city 2 hours away from Mumbai, an NGO is doing just that. Bhargavi Devar founded Bapu Trust to change how mental health services are delivered in India.
We try to do as much of work as possible, enabling communities as a whole to think about their well-being and mental health.
The organization teaches neighbors and families how to best deliver care to patients. Bapu Trust workers like Bharti Misal provide direct counseling as well as referrals for psychiatric care. This model, where neighbors help neighbors, has become popular across India.
We have accepted that we cannot use mental health professionals to deliver mental health treatments because they don't exist. So what do? We take ordinary people and train them to deliver these interventions.
Every morning, Bapu Trust workers get together and plan their day. They set out into the slums, going door to door.
In the slums, people are in and out of people's homes. You cannot hide a person with psychosis over there. You just knock on people's doors and say, do you have somebody who hears voices?
That's how Bapu Trust worker Ratna Bagri found Parveen, who was struggling with 2 sick children and an abusive husband.
मतलब बहुत दवा खाना और घर में झगड़े इसमें दूसरा कुछ ऐसा मालूम नहीं मतलब.
Parveen says that because of Ratna's counseling sessions, her depression has improved remarkably.
मतलब ये बुलाने आते मैडम में घर पे आते बुलाने को फिर जाती और ये घर पे आकर मेरे को व्यायाम वगैरह सिखाते मतलब अभी अच्छा भी लगता है ऐसा पहले कैसा अकेले में रोती थी वगैरह अब वैसा भी कुछ नहीं.
Devar knows well how mental illness can impact a family.
There's a lot of pictures of me and my mom in here.
She was just 5 years old when her mother was sent to an institution. The memories of seeing her mother in the institution still haunt her.
She was on the grills of the mental asylum. She's barely wearing anything, and her hands and legs were tied to the iron grills. Those images don't leave. What I feel bad about was her exclusion, not really her mental illness. How did she live all this? How did she survive? My mother's name was Bapu, and that's the origin. That's Bapu Trust.
Devar is determined to make sure that clients, like this woman Manda, are not stigmatized and abused the way her mother was. Because of her mental disability, Manda was abandoned by her family and shunned by neighbors. She ended up on the streets, where she suffered abuse.
She was speechless when she came. We didn't know who she was, where she was from, who her family was, where she lived. How do you speak to a woman who's speechless? And that's where arts-based therapies comes in a big way.
Devar and her team use art and music therapy, culturally familiar methods that have been proven to help quiet hallucinations and calm some people with severe mental illness. Bapu Trust also activated a safety net around Manda. The organization provided counseling and mobilized community members, like this tea vendor, to open their arms to her. She gives Manda free tea and food every day.
मी तुला कोणासारखी आहे?
The community support helped Manda regain her voice.
People with mental illness have full right to express what they want out of their lives, to say that they will choose to wear this dress rather than that dress, they will go here rather than there. They have the full right to be recognized as a full person with their dignity and respect.
केस पेपर पण सांभाळून ठेव.